today's session. I would like to draw your attention, just a sec here. I'd like to draw your attention to the way that you can ask questions or send comments to me. Please enter your questions or comments in the chat box that you see here. And after covering specific sections in this presentation, I'll give you the opportunity to ask questions. There may also be some time, I'm sure, at the end in order to ask further questions. At the end of today's session, we'd like to know how we did and whether the information was useful. So Alicia will be sending out a PDF of the slides and an evaluation at the end of the week or early next week. If you have registered and we have your email, that will be sent to you. If you have not registered, we would encourage you to send Alicia Marshall at alimarshall@ohri.ca an email so that she can forward these items to you. And that's actually, her email address is in the chat box area. We will be recording this session, and it will be archived and viewed online on the Cochrane Canada website. So without further ado, we can begin. Well, thank you for joining us today for the Cochrane 101 webinar, Everything You Wanted to Know About Cochrane Resources But Were Afraid to Ask. My name is Eileen Villas. I am the Knowledge Broker at Cochrane Canada. And before we begin exploring Cochrane resources, I wanted to update you on Cochrane's new look and branding. This branding update is displayed on the Cochrane website, formerly called Cochrane Collaboration website. There's also the Cochrane Library and resources. All of the Cochrane review groups, centers, and branches also have a new look and feel. At this time, I would like to acknowledge the funders of Cochrane Canada in the past, that's CIHR and the Ontario Ministry of Health. Some of you may be familiar with Cochrane and their systematic reviews. You may have used the Cochrane Library as a resource to find evidence which will help answer your health care questions, but Cochrane has many more resources available. And here's today's outline for the webinar, and the purpose is to provide you with a broader understanding of Cochrane, some of which may be a bit of a repeat, but some things you may not know. It also will look at its reviews and introduce you to the many other Cochrane resources that are at your fingertips. Cochrane is an international non-profit organization. Its aim is to help people make well-informed decisions about healthcare treatments by writing and disseminating systematic reviews so that all the relevant evidence on a specific treatment question is available when people come to make decisions, whether it is about their own health, the health of their family, and whether a person happens to be a healthcare professional providing care or a policymaker making decisions about health systems. Do you recognize this man? Well, you may not recognize him, but he is Archie Cochrane. He was a physician and an epidemiologist from the UK, and in 1979, Archie suggested that it would be important to the medical profession if the results of all studies that looked at how one healthcare treatment compared to another were collected and summarized so doctors could use this to help make decisions on patient care. This approach would become part of the evidence doctors would use when considering treatments, and this is called evidence-based medicine, or part of it. This was such a good idea that when the Cochrane Collaboration was formed in 1993, it was named in his honor. And at this time, he also recommended that researchers use properly designed methods to evaluate healthcare treatments. Have you ever wondered about the symbolism of the Cochrane logo? Well, there is something behind it. Although the Cochrane logo has always had this shape, this is the new rebranded Cochrane logo. The Cochrane logo illustrates both our global objectives and our key scientific processes. The circle formed by the C is Cochrane, and the mirror image of this C symbolizes the collaboration. Together, these two C's form a circle reflecting the international nature of Cochrane that makes our work relevant globally. The vertical and horizontal purple lines in the inner part of the logo illustrate the data from a systematic review. In this case, it's a meta-analysis from a systematic review comparing 7 randomized controlled trials of one healthcare treatment with that of the usual treatment or no treatment at all. Each horizontal line represents the results of one trial. The shorter the line, the more certain the result. The vertical line informs us whether the treatment worked or did not. The horizontal lines on the left side of the vertical line point to the treatment being beneficial, while those on the right side show that the treatment was not effective and in some cases might have actually done more harm than good. The vertical line itself represents the point where there is no difference at all between treatments. The large diamond at the bottom represents the results of all of the studies above that have been combined. Once again, we can immediately see whether the treatment was effective or not. The position of the diamond to the left of the vertical line indicates that the treatment studied was beneficial. If it were to the right of the line, the vertical line, the treatment would not be effective. In this instance, the combination of the 7 randomized studies were of pregnant women who were to give birth to premature babies and were given a short, inexpensive course of corticosteroid to prevent babies from developing lung complications and death associated with premature birth. And this worked. So combining the results of these studies strengthened the evidence for using this treatment. In fact, it reduced the risk of the babies dying from complications of immaturity by 30 to 50%. Before the systematic review was done, most obstetricians had not realized that the cortisone treatment was so effective, and many premature babies developed complications and died or needed more expensive treatment than was necessary. This is a rather dramatic example of the human costs resulting from failure to perform systematic reviews, but it illustrates the importance of combining study results. Cochrane has no geographical boundaries. We want our reviews to be relevant internationally and across different contexts of healthcare. Cochrane's work is carried out in 130 countries by over 37,000 people, most of whom are volunteers contributing as authors, editors, methodologists, and peer reviewers. Almost 10% of Cochrane reviews are produced in Canada with a Canadian lead author. Cochrane has a presence in Canada which includes Cochrane Canada, which supports the people from the Canadian geographical region, and 5 review groups. There's hypertension, back, musculoskeletal, upper GI and pancreatic diseases, inflammatory bowel disease, and functional bowel disorders. And then there's the Cochrane Child Health. Cochrane Canada is a central point of contact for Cochrane in Canada. It promotes awareness and access and use of Cochrane reviews, supports the Cochrane groups physically located in Canada, coordinates training activities across Canada, and develops relationships with partner organizations, whether these are healthcare professional organizations, health policy organizations, consumer organizations, or even research organizations. We also have partnerships with universities, government agencies across Canada too. Now that I've told you a bit about what Cochrane is and does, let's ask, where do people usually find healthcare information? There are certainly many sources like the ones listed here, and it is difficult for lay people and professionals alike to know where to look for trustworthy sources of information which will assist in making healthcare decisions. We know the media provides information. Often there is too much information to read and digest. We also have to ask ourselves whether the information source is reliable. And with headlines like this, where should we begin to look for information based on evidence? And what is really meant by evidence? Evidence-based practice and decisions about healthcare are based on these 3 areas. When healthcare providers and patients make decisions about their health or their patient's health, many things have to be considered. First, information from the healthcare practitioner or research about how the treatment works, any side effects, and here the highest quality of evidence from research should be used. Secondly, healthcare providers consider their own experience and the experience and expertise of their colleagues. Patients may also rely on their own experience and consult friends or family about their treatment experiences. Finally, the values and preferences of the patient and their family have to be considered, and these include the risks of treatment, the results, as well as the cost of treatment. Evidence-based decisions are made up of all these factors and have to be considered. It is assumed healthcare professionals give and the patients receive the best care and treatments the science can provide. However, studies have shown scientific evidence is not always used or used appropriately when care is delivered. And here are some examples. 30 to 40% of patients do not receive the care based on the most recent evidence. And as far as inappropriate practice, somewhere between 20 and 25% of care provided to patients is either unnecessary or potentially harmful. So it begs the question, why does this happen? Like the rest of the population, healthcare professionals need to look for relevant and reliable information. And thanks to the internet, we have more information than we can possibly handle, and it's at our fingertips. Scientists have been publishing journals for at least 350 years. Since then, the number of journals published has risen. In 2012, one estimate puts the count at 1.8 million articles published each year in about 28,000 journals, and that has only increased since that time. The quality of research published varies greatly. Often only research with positive results is published, and this does tend to be a selection bias even in the most trustworthy journals. Back in 1995, an article published in the BMJ found that to keep current, physicians must read 19 new scientific articles per day. So if it takes an hour to read an article times 19, that's 19 hours per day, yet most are only able to devote 1 hour per week to reading. It is no wonder why even those educated in science and healthcare are overwhelmed by the volume of information available, the variety and the quality of evidence, and have limited time to keep up with every new procedure, technology, and medication related to treating and maintaining health. We sometimes find convincing evidence and claims, and it's no wonder that both healthcare providers and patients do not always use evidence in practice. And there are reasons for this. We certainly have covered why information overload occurs with the rapidly changing world of research results. And everyone realizes that information presented needs to be managed in order for us to keep current. Thus, we have to sift through what is available and decide what is relevant and what is not. Often this information management is not successful. Healthcare providers also need to put this information into context. Is the research question asked the same as the clinical question that I have? Is the population involved in the research the same as in my patients? What treatment does the study look at? And is it the one I am looking for my patients? What outcomes are being measured, and what are their conclusions? Many healthcare practitioners may recall some basic training in critical appraisal of research, but don't have the time or aren't able to maintain the skills to use it. As the illustrations on the slide point out, individual studies can be misleading. We look at the studies of health effects of coffee. Is it helpful or harmful, and in what amounts? Can chocolate really benefit your heart? Well, sort of, maybe. Eating peanuts regularly may lengthen lifespan by protecting against diseases such as cancer, heart disease, and diabetes. Depending upon the way the study is really structured and the research question asked and the outcomes that are included, individual studies may differ. So, again, what is one to believe? Well, Archie's vision was that healthcare providers could access a summary of the research evidence to help them choose the treatments that would benefit their patients and reduce harms. And this could be accomplished when the information from a number of single studies, which looked at the same question about healthcare treatment, are combined and more reliable information is provided. And this new publication was called a systematic review. Authors of systematic reviews gather, access, and synthesize the evidence from many studies about the specific health questions, thus providing a big overall picture. Cochrane defines a systematic review as a clearly formulated question that uses systematic or clearly organized approach with specific guidance, looking at maybe explicit methods here to identify, select, and critically appraise relevant research. Data is collected from studies and evaluated before being included in the review. A pyramid simplifies the types of healthcare research being done and indicates what type of research is considered to be the strongest evidence. This pyramid is annotated to illustrate that as research information is filtered and processed, it becomes more valuable. Note that systematic reviews are at the top here. With the sheer volume of individual studies, a summary of the information and results is needed. Systematic reviews are a way in which all or a large majority of research on a given topic is digested and interpreted for the end user. There are three main reasons why systematic reviews are useful. First, they are efficient in bringing together the whole body of research, summarizing existing information, to answer a specific question. This saves readers the time and expertise required to find and evaluate and understand the results from individual studies. Secondly, unlike a single study, a systematic review combines information from a number of single studies and is able to help us review the differences between the studies, find what areas have had an effect on the treatment, allows for exploration of the differences between studies, and identifies those factors that influence the effect of an intervention. Thirdly, they aim to be reliable, presenting an unbiased, comprehensive picture of the available evidence on a large number and variety of clinical questions. This provides guidance to support the decisions in healthcare practice, in policy, or to identify areas where future research may be needed. As valuable as a review is, it is time-consuming to create as well as to read. This slide demonstrates the sections of a systematic review, as well as what the job of authors are to complete the review. Systematic reviews are important to practitioners to determine if an intervention is effective in a situation, to consumers to weigh the potential benefits and harms of alternative types of care, and to policymakers to make choices intended to maximize the health for society in general. There are many questions that people may ask about health care, and here's a list of them. Cochrane answers the questions bolded here in red. What are my treatment options? And what are the benefits and harms of the different treatment options? Reviews addressing health treatments usually follow the standard format of you look at the treatment or intervention for a healthcare problem. And here are a few examples that you can find in the Cochrane Library, as well as there are many, many, many others that really relate to things that people ask, not just if they are have critical healthcare questions, but you know, normal ones such as vitamin C for colds. For instance, is treatment effective in reducing, in this case, an outcome? So is of a specific healthcare problem. So is glucosamine sulfate effective in reducing knee pain in adults with osteoarthritis? There are other questions such as that are based more on a policy level. do school policies prevent the uptake of smoking? So these are broader questions, but still may be addressed. Here are examples of how some Cochrane questions are structured. Questions also are now being included on a test to accuracy. So what is the accuracy of diagnostic test X? So we can now take a look at some examples. So here, what is an effective treatment of Y? So examples of this is, what is an effective treatment for dry mouth symptoms? And this was a review done in August 2013, taking a look at this particular question. What about what is an effective treatment for jellyfish stings? That was in December 13. And here it says evidence of limited quality suggests hot water immersion relieves pain. This treatment may not apply to all species of jellyfish, as only 2 species of jellyfish were involved in the studies. We can take another look at what is the effective treatment of Y in condition X. So what is an effective treatment for shoulder dysfunction in patients treated for head and neck cancer? So looking at exercise interventions, do these actually work? Is treatment Y better than treatment X? So an example would be, is using an electric toothbrush better than a manual toothbrush for oral health? And this is the powered versus manual toothbrushing for oral health in June 2014. It found that powered toothbrushes do reduce plaque and gingivitis more than manual toothbrushing in the short and long term. And 4, what is the accuracy of diagnostic test X? So an example is, what is the accuracy of assessing rotator cuff tears in people with shoulder pain for whom surgery is being considered? And here it takes a look at magnetic resonance imaging, magnetic resonance arthrography, and ultrasonography for assessing rotator cuff tears in people with shoulder pain for whom surgery might be considered. And they were actually, in the evaluation, it said it appears that compared with the ultrasound, the MRI may be more sensitive in identifying partial thickness tears. So they were looking at like full thickness tears and partial thickness tears. And so this would perhaps help a surgeon determine whether or not surgery should go ahead. The Cochrane Library does not answer general healthcare information, such as that on etiology or cause of disease, the outcome of disease, or how and why diseases occur in different groups of people. It also does not answer information on the incidence, that is the rate of a new or newly diagnosed cases of a disease. And also the mechanisms of action of a drug or technology, as well as any needs assessment studies. So at this point, I'd like to ask if any of you have any questions. Okay, and don't see anything coming through. If you do, you can hold them till the next point or at the end. So now we'll take a look at the Cochrane resources and where to find them. Now that you understand what Cochrane, the questions Cochrane answers and how Cochrane works. The main Cochrane resources can be found in 2 places. The Cochrane website, and that was formerly called the Cochrane Collaboration website, and also in the Cochrane Library. Today we will begin our resource tour at the Cochrane website and look at Cochrane evidence, top 10 reviews, podcasts, and pearls. We will begin at the Cochrane, or the former Cochrane Collaboration website at www.cochrane.org. Arrow 1 at the top right points to a link to the Cochrane Library database, which we will explore later. Arrow number 2 points to the latest available Cochrane evidence. That is new and updated reviews that are published, and this also includes an area of the top 10 reviews. First, I want to draw your attention to the Our Evidence section on the top left of the toolbar. This section is a popular place to begin and can be used to go directly to review summaries written in plain language. By clicking on Our Evidence, it will take you directly to a list of the most popular plain language summaries. Here, there's also a search window that you can find. And in order to find a topic you are looking for, you simply enter, example, treatment for conditions such as vitamin C for preventing or treating the common cold. To find all available plain language summaries for a condition, simply enter the condition, and this plain language summary page will also allow you to access the review abstract as well as any other available podcasts and suggested associated topics that may be of interest. So now let's return to the Cochrane.org website and browse further. First, let's familiarize ourselves with the latest Cochrane evidence section. There are 6 reviews listed here, but if you look at the bottom, you can see more, and it will bring you to the latest new and updated reviews. You will notice that there is a list of health topics on the left side. I also see that the review titles and can tell whether the reviews are new or updated, and also they list a publishing date for these reviews. So that gives you a quick idea, and you can scan over to see if they are updated, new, and when they have been published. I have circled in this case the dentistry and oral health topics, and I'm able to see there are 161 reviews in this topic area. I wonder what the subheadings of the dentistry and oral health area are. So when I click on it, I see the expanded section with the subheadings and how many reviews there are in each area. You can sort these reviews by best match, alphabetically from A to Z, alphabetically again from Z to A, or by date published in descending order. So let's see what the review on fluoridation says if I click on it. Here is the summary of the review on water fluoridation to prevent tooth decay. The Cochrane summaries of reviews found on the Cochrane website are revised from the scientific review abstract, which we'll see shortly in the Cochrane Library, and are easier to read and understand because they are written in plain language. The summaries are divided into background, review question, study characteristics, key results, quality of evidence, and author's conclusions. The keywords are underlined and are explained in a pop-up box as your cursor passes over these. These summaries were previously called Cochrane summaries, but have been renamed Cochrane evidence. And by writing the summaries using words familiar to the general public, the aim is to make it both readable and easily understood by all those looking for evidence about healthcare treatments. This not only assists patients in making informed healthcare decisions, but also gives healthcare providers another resource to use when communicating to their patients or their clients. And a few years back, in 2011, the Cochrane summaries and Cochrane evidence actually received a global attention by being awarded the runner-up prize for the best public website by the Plain English campaign. And because they were judged on their content, design, and layout. And the design of the Cochrane evidence focused on easily accessible information merited this recognition. Since Cochrane evidence only began a few years ago, not all Cochrane reviews have summaries. However, new reviews are produced with them, and old ones, when they are updated, eventually do receive one, so that eventually all Cochrane reviews should have summaries. From the Cochrane evidence, you can also get to the review abstract if you want more information. This link will connect you with the Cochrane Library. As an example, here's the water fluoridation review in the Cochrane Library. It begins with the abstract. The divisions of the review abstract are a little bit different from those in Cochrane Evidence, in that each review abstract is divided into background, objectives, search methods, search criteria, data collection and analysis, main results, and author's conclusions. This is a more scientific format, and more methodological details are included. It also offers options such as figures, tables, and references. All abstracts in the Cochrane Library are accessible free of charge by everyone who enters the website. Full reviews can be read if you have a subscription to the Cochrane Library through your Institute of Learning, professional association, or workplace. In Canada, we have been lobbying for free access to all Canadians, but that is yet to come, and we're still continuing to work on this. The Cochrane Library contains more than just Cochrane reviews. There are many other resources, and we will go into that shortly. If we go back to the Cochrane Summaries area and want to do a search, let's search for fluoride. Using fluoride as a search term, it may not be specific enough, as there are some 29 resulting reviews that are not specific for teeth. We see fluoride for bone density and fluoridated milk. You can narrow your search for fluoride in toothpaste. If you search for fluoride and toothpaste or fluoride toothpaste, there are 32 search results. I can read all about these fluoride toothpaste areas, but today I would really like to listen to a podcast and wonder which reviews have podcasts. So I tick off the podcast area further down on this page and find that there are 4 podcasts for our search results on fluoride toothpaste. I have heard about triclosan containing toothpastes for oral health, and today I would like to learn more about the evidence on this topic. So I click on the review title, and it takes me to the Cochrane Evidence Summary, like the one that we saw before, and then to the podcast website. This podcast begins with a written context for this review, saying that there are several Cochrane interventions for brushing teeth, including comparisons of different types of toothbrush and toothpaste varieties. In December 2013, this list grew with a new review of the effects of using a toothpaste containing an antibacterial agent called triclosan. The 2 review authors described the findings in this 4-minute, 48-second podcast. You can also access podcasts directly from the Cochrane Library at www.cochranelibrary.com and use the drop-down menu under More Resources to locate the podcasts. There are over 400 podcasts, each being less than 5 minutes in length. Each podcast includes a short interview with the author, usually in the question and answer format, so that you can better understand the rationale and context of the review. Podcasts are free and downloadable, so they can be listened to at one's convenience. As mentioned, the entire catalog of podcasts are available on the Cochrane Library website. You can search by issue, by title, or by description. I decided to search by using the oral health description and found the 4 podcasts, again, which I had found previously through Cochrane Evidence. You can access podcasts through the Cochrane Library as mentioned, or by subscribing via iTunes for the latest updates. All podcasts are free regardless of how you choose to access them. Whether you listen in your office, on your daily commute, or while exercising or walking the dog, Cochrane podcasts offer a quick and easy way to keep up with the latest evidence from the Cochrane Library. You might also be interested in learning more about some of the 53 review groups in Cochrane. Here are 2 examples of Cochrane review group websites. The upper left shows the Cochrane Hypertension Group, while the Cochrane Oral Health website example is shown on the bottom right. there are 53 review groups to explore, such as back and neck, breast cancer, depression and anxiety, drugs and alcohol, eyes and vision, heart, inflammatory bowel disease, kidney and transplant, pain and palliative care, pregnancy and childbirth, stroke, tobacco, addiction, upper GI and pancreatic diseases, and many, many others. You might want to browse their websites for information, or you might wish to offer input to ensure information and summaries are relevant and readable. You can locate review group websites by going to Contact Us on the upper right side of the Cochrane website and selecting review groups and choosing those of interest. Another educational resource for healthcare providers and also for consumers too that want more information are Cochrane Pearls. These pearls are practical evidence about real-life situations. Here is one about exercise being effective for osteoarthritis of the hip. Pearls are evidence-based summaries of Cochrane reviews in 200 words, produced by the Cochrane Primary Care area. The Pearl gives its message in the title and 4 sections. They provide evidence about the effectiveness of treatments and are used as guidance, but do not, of course, replace clinical judgment in the management of individual cases. Pearls can be found at www.cochraneprimarycare.org. Each pearl is segmented into the clinical question, the bottom line, the caveat, which points out the specific conditions or limitations, and the context. Here's an example of a pearl on no evidence on best filling material for treatment of caries in primary teeth in children. And now we'll take another look at another pearl example. Here's one on the clinical question of how effective are self-help therapies for anxiety disorders in adult? The context of this review was anxiety disorders are the most common mental health problems. They can be chronic and unremitting. Effective treatments are available, but access to services is limited. Self-help therapies aim to deliver treatment with less input from professionals compared with traditional therapies. The bottom line is, compared to no treatment, self-help therapies may be superior. There are positive effects on symptoms of anxiety and depression, response and recovery from illness, disability, and quality of life. Face-to-face interventions may be superior to media-delivered interventions. There were differences favoring face-to-face treatment for symptoms of anxiety, but no significant differences in response and recovery from illness, disability, and quality of life. However, few studies included follow-up after 6 months. Effects were maintained after cessation of treatment. These are only 2 examples of a wide range of primary care topics that pearls cover. Some additional pearl topic areas are the powered toothbrush being more effective than manual for oral health, electromagnetic field treatment effective for osteoarthritis pain, topical corticosteroids effective for nasal polyps, caffeine effective as analgesic adjuvant, that is increasing the pain relief of a standard dose of common pain medications. So as you can see, there are a variety of topics that are also covered in the pearls. Now at this point, I'll ask again if anybody has any questions. Okay, I don't see anybody typing. And now we are going to be moving on to the Cochrane Library and its features. You can go to the Cochrane Library website directly at www.cochranelibrary.com or through the Cochrane web page where we started. This is the home page of the Cochrane Library. The Cochrane Library contains Cochrane reviews as well as a number of other resources. Under the About tab, there's an explanation about the Cochrane Library, which actually contains a collection of 7 different databases. About also explains what we do, who we are, who Cochrane is for and what it's for, how we do what we do and why we do it, and there is a listing of all Cochrane review groups. About Cochrane Reviews explains what a systematic review is. It also describes what a protocol and a meta-analysis is. As well, there are links to the Cochrane Interventions Handbook, which is the official document describing in detail the processes of preparing and maintaining Cochrane reviews. The drop-down Help tab will give you information on how to use the Cochrane Library, which will bring you to this page. Clicking on the search function will bring you to a listing that looks like this. Here you will find a Cochrane Library search tour. You can view a PowerPoint demonstration or download the PowerPoint outlining the search features. There's also a frequently asked questions section. The Cochrane Library search tour is a guide to assist you to develop a search strategy. If we go back to how to use the Cochrane Library tab, you can register for their monthly live online workshops, which is free of charge, so you can learn about and make the most of the Cochrane Library. In addition, there is a two-part self-paced online tutorial designed for users as a quick and informative overview and demonstration of the Cochrane Library. As you can see, there are several options for learning how to navigate and use the Cochrane Library. There's also a tab on the main page called Cochrane Reviews, which explains what is contained in the Cochrane database of systematic reviews. You can search, browse by topic, by review group, look over the table of contents, and even download the Cochrane Library iPad Edition app from iTunes. Again, you can look over editorials and scan the tips and tricks for better searching in the Cochrane Library. The Cochrane Library currently contains almost 6,500 Cochrane reviews and almost 2,500 protocols, which are reviews being developed. Cochrane reviews are published as they are completed, not just on a quarterly or a monthly basis. This way, the latest information can be shared in a timely fashion. Although Cochrane reviews are quite complex and contain many sections, each review, as I mentioned, has an abstract and a plain language summary, which summarizes the review findings in everyday language. Again, this plain language abstract summary is used by the public, healthcare professionals, and policymakers, and is available without a subscription. As you recall, we have taken a brief look at the Cochrane Review abstract before. Now let's take a look at an abstract of this review, which was featured in the Cochrane Library on acupuncture for tension-type headaches. Each review contains an abstract, as I had said, with a plain language summary, some of which are translated into French or into other languages. And I believe that right now there are 7 languages: English, French, Mandarin, Spanish, Portuguese, Croatian, and Russian, although there are more being added all the time. Reviews can run 20 pages to well over 100 pages. However, I must point out it is only accessing the full review that requires a subscription. The abstracts and plain language summaries are accessible free of charge and without a subscription. Perhaps you will remember it was mentioned abstracts are always divided into the same sections for continuity. The plain language summary is either presented as a paragraph or it is divided into the same or similar subtitles appearing in the abstract and is written in a language that is easily digested by most. Sometimes there may be some methodological items contained in that in more plain language. Other times, not so much material in this section. So that's why there is a difference in the subdivisions. Cochrane Special Collections may also be of interest to you. They are a thematic collection of review evidence on topics such as asthma, aspirin and antiplatelet therapy, tobacco, breastfeeding, burns, influenza, hospital-acquired infections, work safety and health, road safety, preventing falls and injuries in older people, exercise for musculoskeletal conditions, prevention and treatment of obesity, breast cancer detection, care homes for older people, acupuncture, telemedicine, and many other topics. Presently, there are 38 special collection themes available, and more are being developed. So if you have the time, take a look at the special collections. You might find it of interest because everything is contained within the thematic area. Another feature on the homepage of the Cochrane Library is the Cochrane Journal Club. Every Cochrane Journal Club article is specially selected from the hundreds of new and updated reviews published in each issue of the Cochrane Library, representing diverse clinical topics, and each one focuses on a review of special interest, such as practice-changing reviews, new methodology, and evidence-based practice. The Journal Club is suited to students, researchers, and clinicians alike. However, topics in the Journal Club may also be relevant for those who are looking for more in-depth information on topics. And access to the Journal Club resources is free. Here is an example of one of 54 Journal Club reviews. This one is on cranberries for preventing urinary tract infection. It contains the complete review to read, relevant background information, a podcast explaining the key points of the review, discussion questions to help you explore the review methods and findings in more detail. There are also downloadable PowerPoint slides, and you can even contact the review authors with your questions. So at this point, again, I'll ask if anybody has any questions before moving on to the final section. Okay, since we have finished our tour of the Cochrane Library, we'll now move to the Cochrane website in Canada. In addition to the resources on the Cochrane and Cochrane Library websites, you will find other resources on the Cochrane Canada website. This is the Cochrane Canada homepage with information about Cochrane Canada, what it does, the latest news, training, and events by starting here at www.ccc.cochrane.org. Here we provide webinars on a broad range of topics, such as an introduction to Cochrane, how to search for information, and how to use the information found in Cochrane reviews. There are a variety of webinars from critical appraisal, communication, understanding and using graphs, and many, many more topics. Some of the more recent topics have focused on policy and decision makers, such as stakeholder dialogues, citizen panels, and the health system learning education program. Other webinars focus on consumers, where to find good evidence and how to use it, while others are aimed at healthcare providers or researchers. Two upcoming topics are decision aids on November 10th and transforming patient care on December 10th. We do encourage you to attend these or look them up in our archived webinar files. We do collaborate with our 26 partner organizations providing joint webinars. Here is the archived webinar page. Archived webinars can be searched by year or by topic. We are always interested in hearing from you, whether you are a healthcare provider, researcher, policymaker, or consumer. We would like to know what topics you would like to see featured in upcoming webinars. Cochrane Canada produces 2 newsletters to keep people informed. The first is Relay Cochrane, which comes out quarterly with summaries of recent published Cochrane reviews. Cochrane Canada Connect also connects, updates subscribers about upcoming Cochrane training opportunities, the local and national events, and what is happening with our partners and at regional sites across Canada. This is a monthly newsletter. We do have a blog, and you can find out more about it on the website and about Cochrane Canada. If you have a story about how Cochrane has made an impact on you as far as making a healthcare decision, we would encourage you to share this with us. Cochrane Canada offers a full menu of Cochrane resources. This handy reference of all Cochrane resources is called Build Your Cochrane Experience with Cochrane Resources, a full menu of knowledge translation activities. We recognize not all individuals or organizations share the same needs and therefore have listed the Cochrane resources, defined their purpose, and indicated whether the resource is live or self-directed, as well as the time it may take to use this resource. For instance, if you want to know more about Cochrane, there is a list of frequently asked questions, which may take 10 to 30 minutes to read. There are other resources such as podcasts, pearls, special collections, which have been described already, as well as many other additional resources. So certainly there is much more to Cochrane resources than meets the eye. I hope that this has informed you and piqued your interest to explore the many resources Cochrane has to offer. And remember, the majority of the resources are available free of charge. To learn more about the resources at Cochrane Canada and at the other Cochrane websites, here is a resource list with the websites. And today we wanted to make you, as I said, aware of what Cochrane resources are available. Here's the list of Cochrane resources that we have looked at, and I hope you will take the time to explore and use these resources as you search for information about healthcare. Thank you very much for joining the webinar today, and if you have any questions, please enter them in the text box. For those of you who have joined a little bit later, I have mentioned that Alicia will be sending out a PDF of these slides as well as an evaluation either by the end of this week or the beginning of next week. If you have registered, we already have your email and we'll send them out. If you, however, have not registered and would like to receive the slides, please email Alicia at Ali Marshall. It's in the chat box area, ALIMARSHALL. So Ali Marshall